go ahead and begin the lower extremity exam. Okay, for this part we won't need the drape, so I'm just going to pull your gown down and we'll get rid of the drape. Okay, and I'm going to inspect the skin for any lesions, discolorations, also looking at the texture and temperature. Okay, and then we'll just pull your gown up to here. How's that? Okay. And we'll go ahead and palpate the hip joint and thighs, knee, patella, and popliteal fossa, checking for pulses and cysts. Okay. And calves, Achilles tendon, calcaneus, lateral and medial malleoli. Okay. And we'll check posterior tibial pulse and dorsalis pedis. Good. Do a general inspection of the metatarsals and toes and capillary refill. Good. Okay. Now let's look at the range of motion of your legs. Just have you lift your leg off the table, all the way up and back down. Good. And now I'm going to move your leg for you. Okay. Move it in abduction and adduction. Okay. And flexion, extension. Do external rotation and internal rotation. And Patrick's. That looks very good. Go ahead and do the same on the other side. Again, flexion, extension, abduction, adduction. Okay, go ahead and bend your knee. All right, do external rotation, internal rotation, and Patrick's. Good. Good. Okay. Now I'm going to have you sit up, okay? So now I'm going to go ahead and test the strength against resistance of your lower extremity. Okay? Go ahead and try to lift your leg off the table and push it down towards the table. Good. And off the table and press down towards the table. Good. Go ahead and try and extend your leg and pull it back towards you. And extend your leg, pull it back towards you. Good. Now looking at the range of motion of your feet. Can you bring your toes up and back down? Okay, and bring the soles of your feet together and away. Good. Can you lift your big toe up? And how about all of your toes up and back down? Good. Okay, and now just relax your foot. This time try and raise your toes up towards you. And now push them down towards the ground. Looking at dorsiflexion and plantar flexion against resistance. Good. Okay, I'm going to have you step off the table here so we can look at your back. All right, I'm going to come around to this other side. All right, and I'm just going to inspect the back, looking at the skin again, and looking for the symmetry of the iliac crest. I'll have you lean forward. And go ahead and look at the curvature of the spine for any lordosis, kyphosis, or scoliosis. You can stand up. Okay, now I'm going to keep my hands on your hips. I'm just going to look at your range of motion a little bit. Can you lean backwards from your hips? Good. Okay, and now to one side and to the other side. Good. Now keeping your hips facing forward, just twist so you're looking behind you. Right, and the other side. Good, excellent.